Hi, my name is Kristen Sanchez, and I want to welcome you to our Tejano virtual events. Today, we have a great presentation for you. We have Ms. Irma Montoya, who's an associate professor here at the Rio Grande campus in the Health Professions and Related Sciences Department. And she's here to talk to us about different things about diabetes. So I'm glad you all are able to join us, and you are going to have an opportunity to earn Tejano passport points today. So I'm going to be putting the code in the chat box later on. So I hope you all take advantage of the Tejano Passport Program. So please get comfortable, mute your mics, and if you have any questions, please put them in the chat box or raise your hands, and we'll be getting to you to answer your questions. So whenever you're ready, Ms. Montoya, you can begin.
Okay, great. Thank you, Kristen. Good afternoon. Again, my name is Irma Montoya. I'm going to go ahead and share my screen with you. If you cannot see it, please let me know. Since I'm sharing the screen, I won't be able to see your questions. So you can just blurt it out if you want to. Or I don't know if any of the other moderators are still there and they see a screen. They see the question there in the chat. Maybe they can alert me to it. But basically, let me go ahead and share my screen so that I can get started here. Okay, can everybody see this screen?
Yes.
Okay. All right. So my presentation is going to start off with just basic information about what diabetes is. So one of the things that as I'm going through this, I do want you to start thinking about what else you want to know about diabetes. I know maybe you want to, maybe you or somebody in your family maybe considered what they call pre-diabetic. So they are very high risk of getting diabetes. They're not diabetic yet, but they may be getting diabetes, or maybe you have somebody in your family or yourself has diabetes that there are questions that you may have that you want to be answered. So please just keep those in mind as we go through this. So this is just a basic introduction to what is diabetes. I know a lot of people hear about it, but they may not understand how it develops, and that's what we're going to be going over. We're also going to define the different types of diabetes. We tend to think of only maybe either you've heard of a type 1 or type 2, but there are other types of diabetes that are out there. Outline the signs and symptoms so that if you feel that you may be pre-diabetic and you did not know or you're not sure, I will be describing what those signs and symptoms are. And or like I said, if you have a family member or somebody else that that you know of that may have these symptoms, that you might want to let them know that they should go to a doctor and look into those things. Some numbers to remember: diabetes is based on amount of sugar levels in your blood, and there are some numbers that we are looking at to diagnose whether you are pre-diabetic or you have diabetes. And so I'll be talking about those as well. And then just a quick overview of complications of mismanaged diabetes. And if we have time, we'll go over a little bit more in detail on those complications, or if you have any other questions, of course, we'll go over that as well. Some vocabulary that you're going to be learning about today, or maybe you already know about them, you should know when we're talking about diabetes, is pancreas, insulin, the words glucose and glucagon, what metabolism is and what that has to do with diabetes, hormones, hormone receptors, beta cells, the terms hyperglycemia or hypoglycemia. Of course, your liver is also part of this. The terms insulin resistance, fasting blood glucose, and GLP-1. So these are some of the vocabulary that are used by medical doctors and nurses that are referring to issues with diabetes, or maybe they explain things to you and they mention these terms. Okay, so the first thing we're going to do is you need to understand how your sugar is metabolized in your body. And I'm going to show you a video. You let me know if you can hear it, okay? Or if there's feedback or anything like that. So let me go ahead and start off.
Diabetes is a condition in which sugar levels in your blood are high. When you eat, some of your food is broken down into sugar, also called glucose. Sugar travels in your blood to all of your body's cells. Why is insulin important? Insulin helps sugar move from your blood into your cells. Insulin is a hormone that is made by beta cells in your pancreas. Cells in your body need sugar for energy. Sugar from food makes your blood sugar levels go up if it cannot get into the cells. Insulin made by beta cells lowers your blood sugar levels by helping sugar move from your blood into your cells. Diabetes is a condition in...
So basically, this video just shows you how your sugar is being used in your blood. So whenever you eat, I don't know if you knew this already, but most of your body uses sugar for energy. And that's the reason why you need to eat what we call carbohydrates. And sugars is basically another word for carbohydrates. There are very different types of carbohydrates that we eat. There are some that last longer than others in our system. Some of them are are used up fast, like your regular, like a candy or fruit sugars. Okay, those give you a burst of energy really, and in a short period of time. Okay, and then after that, you kind of have like a little, kind of like a crash, because you've used up all that sugar. And it's gone. Okay, so but if you eat, let's say, like a long chain carbohydrate, which would be like a pasta or whole grains, rice, starches, those kind of carbohydrates, those are also sugars, but they tend to be, because of the molecular structure of it, they're longer and they stay longer in your system, and so you're not as hungry, or don't stay as hungry when you eat them. Okay, the problem that we have a lot of the times is that we eat too much of those things, and so what happens is that if you have diabetes, those sugar levels that you are not using will stay in the blood, and that causes problems with the way that the sugar is metabolized, and that's what we're going to go over. So your pancreas obviously is a very important organ, because the pancreas is the one that provides the hormone that's called insulin, and that insulin is the hormone that allows your cells to open up and allow the sugar to go in, because the sugar cannot go into your cells to be used as energy just just like that. Okay, the cells have to be opened like a lock and key mechanism, and so the insulin turns on or opens the lock so that the sugar can pass through into the cell and the cell can be used. So when someone who has diabetes, depending on what kind of diabetes they have, they may not be able to use the sugar, and that later on you'll see that it causes certain signs and symptoms because the sugar is just roaming around in the blood, it's not being used. Okay, like I said, if you have any questions, I cannot, because I'm sharing the screen, I cannot see your chat, so you can just go ahead and just say, I have a question out loud if you want to. All right, okay, so let's look at the next video.
In addition to insulin, there is also another hormone made in the pancreas called glucagon that tells the liver to release stored sugar if your blood sugar gets too low or if you have not eaten for many hours, such as overnight. What other hormones are involved in diabetes? When you eat, another hormone made in the gut helps the pancreas produce the right amount of insulin to move sugar from the blood into the cells. This hormone is called glucagon-like peptide 1, or GLP-1. One of its primary actions is to stimulate the beta cells in the pancreas to produce insulin when the blood sugar is too high. It also helps to lower the amount of sugar made by the liver. In addition to insulin,
So basically, you have these three hormones that are working together to make sure that you have the right amount of insulin in your body. So insulin is one of the hormones that obviously, like I said, it opens up that lock in order for the sugar to get into your cells. But the other two hormones, the glucagon and the GLP-1, what those do is they regulate the amount of insulin that's being used. Because when you're born, your pancreas has allotted the number or the amount of insulin that you're going to have for the rest of your life. So when someone has, for example, type 2 diabetes, their conditions that they're in, their body is causing the number of, or the amount of insulin that's secreted into the blood is being secreted too much too soon. Okay, and so what that means is that eventually the pancreas is not going to have enough insulin for the rest of the person's life. Okay, so if you think about it, as you get older, naturally some of your organs are not going to be functioning as well as they were when you were 20 years of age. Okay, it's just the natural thing. Okay, so someone who doesn't have history of diabetes, or somebody who does not have a family member who already has diabetes, they may still get diabetes, but at a very much older age. And it's a natural thing that occurs. Okay, it's not because they were overweight or because they had other risk factors. It's because naturally the pancreas is not functioning the way it was. And so that can cause that situation where you're going to have diabetes, but at a much older age. Let's say you're like 70 or 80 years of age. Okay, but someone who gets diabetes when they're younger, 30, 40, 50 years of age, that is probably due because of other issues that are going on in the body that's affecting the way that these hormones, the GLP-1 and the glucagon, are being used to regulate the amount of insulin. And so there's just way too much insulin being used, and that causes a chain reaction that leads to diabetes. Okay. Sorry. Let me go back to this. Okay, next one.
What happens in diabetes? The most common types of diabetes are type 1 and type 2. In type 1 diabetes, the body makes little or no insulin, so people with type 1 diabetes must take insulin every day. Type 1 diabetes is usually diagnosed more often in children and young adults. In type 2 diabetes, the body prevents the insulin it does make from working right. The body may make some insulin, but not enough. Most people with diabetes, about 90%, have type 2. This kind of diabetes usually happens in people who are older or in those who are overweight.
Okay, so the type 1 diabetes got blurred out, but basically you see the difference between what a type 1 and type 2 diabetic is. Okay, the majority of the people that you may know who have diabetes would be a type 2 diabetes. And again, most of them are older, but we are seeing younger people like in their teens and 20s getting diagnosed with type 2 diabetes because of the fact that they're leading a much more sedentary lifestyle, and they are probably obese or overweight. Okay, aside from the fact that they may also have family members who are also suffering from diabetes. Okay, so that one has to do with those hormones and not being able to use the insulin correctly. Okay, so that leads to type 2 diabetes. A type 1 diabetic will be usually is a younger person, probably in their teens or preteen. Okay, where they show these signs and symptoms talk about later, where the pancreas is not functioning. This is usually an autoimmune condition, and it causes the reduction or the cessation of insulin completely. And so that can be obviously a major life hazard, because without the insulin, there's no way that your cells can have sugar, can use the sugar as their energy source. And so basically what's happening to the body is that you're starving to death. And so that's what happens. That's why they have to inject insulin all the time, or else they are in danger of dying. Okay, so those are the two major ones, the type 1 and type 2. So we'll talk about how type 1 develops a little bit more in detail.
What causes type 1 diabetes? Even though the exact cause is unknown, in type 1 diabetes, cells from the body's immune system attack the insulin-making beta cells of the pancreas. Without symptoms or pain, over a period of months or years, the beta cells are killed. As a result, the body does not have enough insulin. Normally, insulin helps the cells of the body take sugar out of the blood. Cells use the sugar as fuel. Without insulin, sugar builds up in the blood. This can harm blood vessels. It can also cause heart disease, blindness, and kidney failure. To keep these things from happening, people with type 1 diabetes take insulin several times daily. Most people with type 1 diabetes are diagnosed around the age of 12. What causes?
Okay, so that's type 1 diabetes. Let's look at, where am I? There we go. Type 2, so you can see the difference.
What causes type 2 diabetes? In type 2 diabetes, the body either does not make enough insulin or is not able to use it properly. Type 2 diabetes usually begins with insulin resistance. This is when the cells can't use insulin properly. As we explained earlier, insulin is a hormone made in the pancreas, a gland near the small intestines. Special cells in the pancreas, called beta cells, make the insulin. The body constantly checks how much sugar is in the bloodstream. When blood sugar levels rise beyond a certain point, the body signals the pancreas to release insulin. Insulin helps the cells use sugar. The diagnosis of diabetes is given when not enough insulin is available, either because the pancreas can no longer keep up with the demand, or because the body can't use the insulin that is produced. Let's take a closer look. What causes type 2 diabetes?
So let me go directly to the next video so you can see how this insulin works, or the insulin resistance is caused.
Let's take a closer look. Cell walls have little locks called receptors. Insulin fits into those locks like a key. When insulin opens the locks, sugar is allowed to enter the cells. When the body is not able to make enough insulin, blood sugar is locked out of the cells. Sometimes the locks change in shape. Then the insulin can no longer fit into them. Either way, blood sugar is locked out of the cell. It stays in the bloodstream and can become too high, causing hyperglycemia, which can lead to the symptoms of diabetes. When cells cannot get sugar, they no longer have the fuel they need. The pancreas tries to make up for this by working harder. At first, the pancreas keeps up by making more insulin. In time, the pancreas is unable to continue doing this, which is when the symptoms of diabetes may appear.
So when that happens, that the pancreas does not have enough insulin, this is usually when you're going to have that diagnosis, like the video says. But the other issue is that there's two varieties of even within type 2 diabetes. So someone who has type 2 diabetes can still have enough insulin to continue, but they need help, and that's where they have either the doctor will give you some sort of metformin is usually the first type of medication that's given. It's an oral medication, and it helps in reducing the amount of sugar that's in the blood. There's a lot of different types of oral medications. The doctor will be the one to prescribe the ones that will fit better for you, especially if you have other conditions that are that compound the diagnosis of type 2 diabetes. For example, if you're suffering with high cholesterol or high triglycerides. And so they would choose the type of oral medication that would help you. And of course, you're going to have to change the way that you eat, and probably increase your physical activity, because all of those things will affect how much sugar stays in the blood and how well it's being used as to be able to burn out the calories and all that kind of stuff. So some type 2 diabetics, especially the ones that are first diagnosed, probably still do have enough insulin, but they just need a little bit of help, and that's what the medication is for. When you have extreme levels of high sugar or hyperglycemia, like for years, and you haven't been managing and you have other complications that are occurring and you didn't know you have diabetes, then what's probably going to happen is they're going to check to see how much insulin you have. They might have to ask you to do insulin injections. So there are type 2 diabetics who have to inject insulin because at that point there is not enough insulin at all. And it's been such, the situation has been extreme where that has to be used. Okay. Usually what happens, like in the hospitals, if a type 2 diabetic goes into the hospital for surgery or whatever, they cannot be given oral medication to handle or manage their diabetes. What's going to happen to them usually is that they are injected insulin to manage the diabetes while they're in the hospital. Once they get out of the hospital, if they were not using insulin to begin with, they probably just put them back on the oral medication and make sure that they're eating well and so forth in the recuperation. Or they might give them insulin in the meantime until they recuperate fully from whatever the procedure was, and then they'll go back into oral medication. So someone who is using insulin doesn't necessarily have to stay on insulin as long as they manage their diabetes by having the good diet and the exercise to help them out as well at that, and then they can go back to oral medication. It just depends on what complications the person had. Okay. But you notice on the video it showed you that lock and key mechanism I was telling you about. Okay, so that's very important. The problem with hormones in general is that you cannot replace hormones. You cannot go, I cannot take insulin and say, oh, I don't have enough insulin. Let's just put in another type of hormone to replace it, and your body can continue to open that lock. It doesn't work that way. It has to be insulin. So once insulin is gone, then you're going to have to manually inject the insulin in you, because your body cannot use another hormone that's in the body to replace it. And none of these hormones can be that way. Once you're done with these hormones, you have to physically replace them with the same hormone. Okay. All right. So before I go on, is there any questions on any of this that I had mentioned? Remember, you have to speak out loud if you have a question, because I can't see the chat.
I have a question.
Sure.
Once you are diagnosed, I guess pre-diabetic or maybe the early beginnings of diabetic, is there any way of reversing that altogether to get rid of any oral medication you might be given?
Yes, you can. I mean, you're not considered cured. I would not think of it that way, but you can absolutely manage your condition so that you would not have to be taking oral medication anymore. But you need to, I don't want to say you're going to be on a strict diet, because relatively speaking, diabetics can eat pretty much anything. It's just the proportion. It's the portions that you're eating that is going to affect how much sugar level, how high your sugar is going to be in your blood. And the fact that if you learn how to use your glucometer, the instrument that you use to prick, you prick your finger and get the blood sample, and the little machine measures how much sugar you have in your blood. If you know your numbers well and you gauge and understand that what you eat is equal to that number that you get, then you can manage how you eat and what you eat so that your numbers stay within a range and you're good to go. So it's a matter of getting used to doing that. And I say that you can do it because I've seen people where I used to work at a clinic, and so once they start changing their way of eating and exercising a little bit more, it doesn't have to be major exercise, just moving enough so that their blood sugar can be controlled. Yeah, definitely. You might be able to either reduce the amount, the dosage of the medication, little by little, or up to the point where maybe the doctor can say, "Oh no, you're doing fine. You've been doing fine for months or years or a year or so, and then we'll just remove it and see how you do." But it's all of this has to be under the direction of a physician, because you can't just say, "Oh, I don't want to take the medication anymore. I feel fine. Everything's fine," because it can creep up on you again. So yeah, and it's the same thing with insulin. Let's say you're so high up in the sugar level that you have to take insulin, but you're type 2 and not type 1, because type 1 has to take insulin all the time. But if you're type 2 and the doctor says you have to take insulin as part of your treatment, eventually that can be, again, the dosage can be cut down and then maybe removed, and then you're just on oral medication, and then you can reduce the dosage on that and so forth. It just depends on if you have other conditions that are compounding the situation, and always under the direction of your physician. I don't know, did that make sense? It's a long-winded answer there.
Yes, thank you.
Okay. Anybody else have another question before I go on? Okay. So the other types of diabetes, if you didn't know, there are what we call gestational diabetes. Gestational diabetes is basically like the type 2 diabetes that occurs during the second or third trimester of a pregnant woman. That's why they have a test where they take this nasty orange liquid. It's super, super, super sweet. And you take it, and usually it's the same type of way you test for anybody else, but usually they use it for pregnant women. They're going to be checking for whether they have diabetes or not. So you take this super, super sweet liquid, you wait for an hour there, and then they take your a blood sample and check to see how much sugar you have. So again, depending on those numbers, they'll determine whether you have diabetes or not during the pregnancy. That can be hazardous because it can affect the baby's weight, the mama's health, and so forth. That's going to be a high risk pregnancy. Once the woman has given birth, usually these diabetic conditions go away. However, they are at very high risk of getting diabetes later in life because they already shown the propensity of having it. So a woman who has been diagnosed with gestational diabetes will have a high risk of getting type 2 diabetes later on in life if they're not careful. Okay. Monogenic diabetes syndromes such as neonatal diabetes or maturity onset of diabetes of the young, these are genetic conditions where the pancreas is just not functioning anymore, or again loses the number of the amount of insulin that it produces, and so type 1 diabetes sets in, either because they were born with that situation, this is a very young newborn situation, or a young adult or an older adult that can also get type 1 diabetes, as opposed to the normal range, which is, like I said, the preteen or teen range for type 1. Diseases of the pancreas, such as pancreatitis or cystic fibrosis or pancreatic cancer, anything that that causes problems with the physical problems for the pancreas due to diseases of the pancreas can also uh, um, cause diabetes. Drug or chemical induced diabetes, such as with treatments for HIV or AIDS or after organ transplantation, that can also occur. Again, these are things that are typically not under our control. Okay, it's just one of those things that happens that affect the pancreas, and the pancreas then loses the amount of insulin, and therefore diabetes kicks in, as opposed to like type 2 diabetes, which is can be affected by both factors that you can control and factors that you cannot control. Okay. All right, so someone who is thinking that they might have diabetes, or you may know of somebody that you think may have diabetes, some of the signs and symptoms that you may see on them is constant urination, constant thirst, they're hungry all the time. I know a lot of us have this, that we're hungry all the time, but this is extreme. Okay. Unexplainable weight loss. You may think that the reason for the unexplainable weight loss is because, again, your body is basically starving. Because if there's not enough insulin, or there's insulin resistance, and so those locks are not open so the sugar can get into the cells, what's happening is that your body has to transfer the use of sugar as fuel to something else. And you may have heard of this, and it's called ketosis. Okay, so that's why you hear that word, the keto diet. Okay, so keto is referring to ketosis, where your body, when you are not eating a lot of carb, what your body transfers from sugar fuel goes to fat fuel. Okay, and so that's the reason why there's that weight loss. Okay, but your brain and other organs in your body use sugar as fuel. So the problem becomes in someone who has a keto diet, you're not supposed to not eat carbs completely. Okay, you do need carbs. You just need to choose good carbs. Okay, you do need to eat good sugar. All right, but, and like I said, not overuse. Don't overeat on the carb. Okay, you still have to have a little bit of it. You just have to choose the right ones and in the right portion. Okay. But what happens with a diabetic is that you don't ever switch back to the use of sugar because you can't. Okay, someone who's on a keto diet and is healthy will eventually go back and forth. Okay, they can use sugar, they can use the fat, they can use sugar, they go back and forth. Okay, and it's a normal reaction your body should have. Okay, and the keto diet, the idea is that you train your body to be able to go back and forth. But someone who has diabetes cannot go back and forth because there's no insulin, or there's not enough, the insulin resistance is causing that sugar to spike up in their blood, and they cannot go back. Okay, so they're constantly using fat. But when your body uses up all the fat that you have, it starts using also muscle. And that is a very dangerous situation, because now you're going from ketosis to what they call ketoacidosis. Okay, and that is going to be very, very dangerous. So when the body goes into ketoacidosis, now you have an increase in problems with your kidneys. You have a higher rate of going into a coma or death. And so that's the danger of someone who is not eating enough carb. Okay, for a long period of time. This is not like one day. This is like a long time. So we have to watch out for that with someone with diabetes. Okay, and that's where that unexplainable weight loss occurs. Wounds that don't heal, dizziness and or blurry vision. I'm sorry. Dizziness, and you see this quite easily when you have not eaten for a while, and you're hungry, but you're like, you're distracted and you're not eating when you're supposed to, what do you feel? You feel shaky, right? The shakes. You start getting hangry, what they call hangry, right? You're hungry and you're angry at the same time. Okay. You may have dizziness, you're lightheaded. Those kind of things are occurring naturally because your body is starving. It needs sugar and you haven't eaten yet. So someone who is getting into that situation of diabetes, this is what they feel a lot of the time. Okay, not just even after they eat. That's the difference between someone who's healthy and is getting the shakes because they haven't eaten versus someone who is pre-diabetic or diabetic and they are eating, but they're still feeling the symptoms. Okay, because of the fact that they're not eating well or they're not getting enough energy, they feel fatigue. They have frequent infections, numb or tingling hands or feet. Those are things that are happening because their sugar levels are really, really high. And then for some people, if you've ever seen them on the back of their neck, they have this really dark patch of velvety skin. And that could be a sign of them having diabetes. Okay. So the difference between one who has type 1 and one who has type 2 is that the person who has type 1, all of these signs and symptoms may occur very, very quickly. Okay. In a short period of time. Versus someone who has type 2 diabetes may not be noticing them because it takes a long time. So when somebody says that, oh, I got a really big scare and now I have diabetes. I don't know if you've ever heard of somebody saying that. Or I went into the hospital and now I have diabetes because I went into the hospital. No, it's your body has already been in either pre-diabetes or in diabetes for a long period of time, and you just never knew it because your body has compensated for the feelings that you have, or you just have been distracted and you never noticed that you had these symptoms until something really bad happened, and then now you're all of a sudden you've been diagnosed. Okay, so that sometimes occurs. So the risk factors for prediabetes or diabetes is sections that you can control and those that you cannot. So let's go over the ones that you cannot. If you are age over 35, if you're male versus female, doesn't mean that females don't get diabetes, but more males have diabetes than females. At your ethnicity, okay, African American, Latino, Asian American, and Pacific Islander, Native American, those are higher risk of getting diabetes. If you have history of diabetes, your family member, or have cardiovascular disease, any in your family member, especially your mom and dad, brother, sister, immediate family, those raise the risks as opposed to somebody who's like an aunt or an uncle. Okay. Genetics, we talked about that like in certain type 1 situations. Previous diagnosis, again, gestational diabetes for women, and in women with polycystic ovarian syndrome, that can also raise the risk of having diabetes. Those that you can control, whether if you are already overweight or obese, if you have a sedentary lifestyle, those are things that you can change right now so that you don't enter, let's say you are pre-diabetic. If you change the way that you eat and you exercise and start losing weight, that will keep you from becoming diabetic. If your hypertension, again, if you can control your high blood pressure, that will help. If you already have cardiovascular disease, but you can control it, manage it, you don't have diabetes, but you do have cardiovascular disease. If you can manage that, that'll keep diabetes at bay. If you have HDL cholesterol lower than 35 milligrams per deciliter and or triglycerides higher than 250, again, if you manage this and you're able to raise your good cholesterol, that's what HDL is, and lower your fat content in your blood, that's triglycerides, again, eating and exercising, that will also keep diabetes at bay. If you're HIV positive, depending on medications that you use, that can also be led to diabetes. That needs to be managed as well. Okay. So the way that diabetes is diagnosed, we use a fasting plasma glucose or fasting blood sugar. That's the one with the glucometer that we were talking about. We can also use a 2-hour plasma glucose measurement using an oral glucose tolerance test. That's the one where you drink that nasty, ugly, sweet liquid, okay, and then you wait and you give a blood test. Or you do an HbA1c or A1c test. This is a blood test that's measuring how much sugar is attached to your hemoglobin because it hasn't been removed, and that's an accumulation of that hasn't been used. And so that's another way of checking to see if you have diabetes or not, or pre-diabetes. So if you're pre-diabetic, you're looking at a fasting blood sugar of 100 milligrams, and this is the glucometer example. So you would look at the numbers there when you prick your finger and you measure it. If you have 100 milligrams per deciliter, or you have an oral test between 140 to 199, or you have an A1C between 5.7 and 6.4, also with signs and symptoms, okay, then you're more than likely going to be considered pre-diabetic, okay? If you have numbers that are over or equal of 126 for fasting blood glucose, the oral test of over 200, or the A1C over 6.5, again with some signs and symptoms, you'll be considered type 2 diabetes. With type 1, you notice that the numbers are a little bit, look more like a pre-diabetic, okay? But the difference here is that you also show antibodies for the insulin, because again, type 1 diabetes is usually an autoimmune condition where your immune system is attacking the beta cells. And so if there's antibodies in that for that, then they're more likely be type 1 as opposed to pre-diabetic. Okay, so those are numbers that you're looking at to see where you are. So to go back to your question about whether you can reduce the medication or get off the medication if you're pre-diabetic or diabetic, you can if you manage your numbers. And this is very important. A lot of diabetics do not do this. They do not spend the time to check on their insulin, not insulin, but on the sugar level in their blood. If you do that and you know exactly what you did, what behavior you did in order to either increase or decrease that number, then you know how to manage it, okay? But if you don't do this and you're not looking at your numbers consistently, at least for the first, first 2 months or so, 2 or 3 months, then you don't understand the pattern that your body's going through, because everybody's going to be different, okay? And so that would be the best way for you to manage it. So complications of diabetes, just a quick overview, obviously can cause problems with the heart, okay, especially coronary artery disease due to high cholesterol and high triglycerides. There is a connection between too much sugar in the blood and the way that the cholesterol and triglycerides are being used, or not being used, but they stay in the arteries, okay? So there's a connection between the two, and that's where the heart disease comes into play. You can also suffer from chronic kidney disease. Your kidneys are filters, and if you fill those filters with too much sugar, it's not going to filter correctly. So that's a simplistic way of explaining how you get kidney damage from your hyperglycemia. Nerve damage or neuropathy, same reasoning. Your nerve endings cannot give out the right signals, and so therefore you have problems determining pain or sensation, or that's why you get that tingling sensation. Some people that have mismanaged diabetes will hit their foot and they'll feel the pain in their fingertips or their ears, and they don't realize that they hurt their foot because it's not coming from in the correct location. So they have peripheral nerve damage. Okay, that can also happen. Aside from also circulatory problems, which also affects foot health, and you can get hearing loss, blindness. Okay, and it obviously affects your mental health because you don't feel good, and you're upset or you're distraught. You can get depressed, and that causes other chain reactions. Okay, so those are the resources that I used for this video. Are there specific questions that you have? Let me go back to my screen here. Anybody have a specific question?
So Irma, I do. I have a question. So let's just say that your doctor tells you you're pre-diabetic. What do you recommend? Or what would be a source they could go to?
Okay, well, you can go to the American Diabetes Association website. Let me go into there. Let me find it for you so you can see it. And now let me share the screen. Hold on. Woohoo! Where am I? Okay, share screen. The Centers for Disease Control also has good information. So this is the American Diabetes Association. Let me just go to the home page. But they have journals here if you want to look at that. But I'm trying to find. Let me go to the right place here. Because that one's more. Oh, wait a minute. Do I have it? Let me see. This is the one. No, this is for educators. So let me. I'm trying to find just the. But that would be. That'd be a good place to go if you want to get research information. Okay, right here. See, tools and support, consumer guides, prevention, things like that. If you want to read through that, that would be a good site. The Centers for Disease Control also has things on diabetes. Is another good website. Okay, gives basic information, pre-diabetes and symptoms, fast facts, how do you live with diabetes, that kind of thing. Okay, but primarily what I would suggest to do is really either talk to a nurse educator or a patient educator and talk about what you need to, first of all, find a purchase a glucometer. Make sure that you have one because you really need to check sugar levels. That's one of the first things that you're going to have to do. Okay, learn what numbers you're supposed to have. Okay, learn your sugar levels by number. Okay, you need to the easiest way to start off is buy a diabetic cookbook to get you into the idea that how do I change the way that I eat so that I can start helping myself, reduce the amount of carb that I'm eating. Okay, remember, it's not that you cannot eat a lot of stuff. It's just you need to choose wisely. Okay, and you also need to choose how you the portions that you eat. Okay, and that'll depend on your levels of activity. Not all diabetics are overweight, okay? So just for you to be aware. But you also need to be active. If you don't walk consistently throughout the day, then increase just your walking. That's the first step. Okay, so increase physical activity. Doesn't mean that you have to go do aerobics. Okay, it just means that you just have to move. Let me just put this right. Physical activity. Okay, it doesn't require for you to go to a gym and start working out like that. It doesn't have to be that way. If you don't make time to just walk around every day, just do that to start off with. So if you know that you already, let's say you're drinking a lot of soda, okay, cut down on the soda 1 week. If you and then the next week, don't drink that at all. If you want the carbonated feel, drink one of those carbonated waters, so that you can get the carbonation, but you're not getting the sugar. And eventually you just drop down to water. Water is good. You don't need to drink sodas, okay? But if you have that thing because you want to have the carbonated feel, then that's another easy thing to do. But mainly, really, is make sure you have that glucometer, because that's the only way that you can gauge as to if your behavior is actually affecting your sugar level. Because that's the only way that you're going to know how to do that.
I have a question concerning the glucometer.
Uh-huh.
Are there any options other than pricking your fingers? I know we've seen on TV announcements where you put this thing on your arm and you read it, or you with some
Yes.
sort of reader.
Yeah, you can do that. That one's awesome. The only problem is that whether your insurance will pay for it or not. That's the only issue. But
So how is it attached to the body?
it's like how can I put it? I think it's called Libre. Is that what it's called? Libre?
I think that's one of them, yes.
Freestyle Libre glucometer. It's attached. It's like how can I put it? It has like some sort of sensor that you actually you poke yourself, and the thing is attached to you. Okay, there's like a little mechanism that you attach to your body, and you decide where you want to put it. Okay, and then you either use your phone, and it has access to your blood. That's why you have to prick it. I mean, it lasts like, I think, a week or 2 weeks, I think, or something like that. And you have to watch out, make sure that it doesn't get too wet, because then it might fall off sooner. Okay, but you attach it to your body, okay, and it has access to your blood. So there's like a little needle of some sort, okay, and you stick it on, and then the outer part of it is like a sensor. So you need, either they give you a sensor, a mechanism, like a little phone-like sensor, okay, or you can use an app on your phone, and then you just put it up against the thing that you put on your body, and it attaches. Okay, so that's pretty much how it works. Let me see if they have a. So the only problem that I see with that is whether your insurance will pay for it or not. That's the only problem. For some people, it will pay, and for some, like my father has WellCare. That's a Medicare Advantage plan, and it does not allow for it. It doesn't pay for it. So I don't know, it just depends on your insurance. But that's a really good way of doing it. That way you don't have to be pricking yourself. Now, here's the thing, okay? When you start using the glucometer, you can start off your fasting blood sugar. Absolutely, you have to check that one because that's very important. Because if you need to keep that low so that during the day it doesn't go up too high, okay? And low, I mean in a range of 90 to 120, something like that, okay? You don't ever want to go below 70. Nobody should ever go below 70 because that means that you have the opposite situation. You have hypoglycemia. That means you have too little sugar and you can go into that coma or ketoacidosis. So that's dangerous. You don't want that. But the other key measurement probably would be at lunch or at dinner. So if you can check yourself twice a day so you can see what happens to your blood sugar depending on whether you eat or you exercise or whatever, then you can start gauging what happens. And then after a while, all you really need to check is your fasting blood sugar to make sure you're okay. Or then later on, you might even just do it every other day. So eventually you may not have to be using it that often. You still use it, but not as often. Okay. My father uses it 3 times a day only because he's kind of like OCD. So he like really wants to know what's happening. But he's used to it now. So, but it helps him a lot because as soon as he knows that his blood sugar is spiking, he starts walking around, he checks it again, and it goes back to normal. So, that's how it works for him. Did that help, Tony?
Yes, it does. I was just wondering because they never explain. I wasn't sure if it was something that pricks into your skin or if it was maybe somehow using an adhesive of some sort. I wasn't sure.
It has both. So it stays on you, but it doesn't stay on forever. It actually falls off. So then you're gonna have to put another one on again. So yeah. Like once you put it on, you can't like detach it. I mean, you can, but it's gonna hurt a little bit. So you just leave it on and then use the monitor to see what your sugar levels are. But I mean, if you can purchase it or if you can if your insurance pays for it or pays some of it, that's a great tool. Especially if you're type 1 diabetic. They have other mechanisms. They have another insulin machine, that they have it connected by a catheter. So that's a little bit different. Anybody else have another question?
Well, thank you so much. This is awesome.
Okay. There's another thing that I wanted to say is that write everything down. If you can, get yourself a notebook and just start writing how you feel. What does it feel to have like a 140 versus a 200 level of sugar in your blood? Did you feel dizzy today? Do you have energy or I ate this, so this is what happened to my blood sugar, whatever. So if you keep notes and you keep track of yourself that way, eventually it comes second nature to you so that you can, eventually it becomes like it's a part of you. Diabetes should not be like, oh my God, I have this terrible disease. Yeah, it can be, but as long as you manage it, you can live a long life and not be traumatized too much by it. It's just a matter of you doing what the pancreas usually would do for you is basically what you're doing. So it can be managed and you'll still be having a fulfilled life.
Well, thank you. All of this is really great and helpful information. So if anybody has any questions, start talking to your doctor. Make sure you look at those
Yes.
websites. I did post them. I did post the diabetes.org as well as the cdc.gov/diabetes.
Oh,
Um,
thank you.
Sure, of course. No, thank you for all this information. It's a great way to learn how to get started. And I know the college is also doing some walking programs. So make
Yeah.
sure you check into those as well. They are Monday through Thursday for the most part at most campuses. So if there's any questions, you can get in touch with me, and I will let you know where you can find that walking program at your campus. I'm putting my email in the chat, and Ms. Montoya did as well. So again, thank you all for joining us and thank you for your great presentation. We do have the ability to get Tejano passport points, and I have put that in the chat as well. And I'm going to go ahead and post it again. And then you can also go to the Tejano Passport Program webpage to sign up if you haven't done that already. So there's their code for attending today. And I thank you all for joining us. Next week, we will have a workshop on Friday called Exploring a Career in Libraries, and I will be giving that session. So I hope you can join us next Friday at 1 o'clock. And again, thank you all, and I hope you have a great weekend.